One of the biggest concerns when we're actually evaluating someone that has recurrence is a lot of the post-surgical changes that we know. There is a spectrum, a kind of an overlying spectrum of benign as well as recurrent or malignant features. And so it's probably one of the things that we have the hardest time as radiologists reviewing. One of the things that we can do to evaluate patients that wind up having a potential recurrence is mammography. Digital breast tomosynthesis has probably been the best thing of us evaluating whether there is a potential recurrence or not, as we can see through dense tissue as well as the fibrosis that can potentially occur with post-surgical changes. The key thing to remember when evaluating patients that might have a possible recurrence is the fact that they have post-surgical changes that can be very normal. Usually patients might have a palpable lump or new symptom, and that should be evaluated with concern. The one thing that we do know is that particularly fat necrosis, which is one of the common things that we actually wind up seeing in women that have post-surgical changes, that can be a little confusing. And sometimes you may have to add additional tools that we might have in our toolbox in order to evaluate those patients for the possibility of having recurrence. So you may have a patient, if they have a palpable area of concern, that ultrasound should be performed in addition to that of mammography. And sometimes we may need to add the advent of breast MRI as well.